So basically, the urinary stones are nothing but deposits of the minerals which are dissolved in the urine, which actually form in the kidney. So these are actually the storehouse of bacteria, and if at all it becomes severe, it can even spread into the bloodstream and sometimes cause sepsis. This urinary infection can sometimes be very mild and trivial. However, it can also ascend into the kidneys and cause very severe infection, which we know call it as pyelonephritis. Patients come with simple symptoms like burning sensation while passing urine, sometimes even blood in the urine. They can also have pain on the side of the abdomen, which we call as flank pain. So all these symptoms classically point towards urinary infection. First and foremost, adequate hydration is important. For an average adult, consuming about 2.5 to 3 liters of water per day. So this helps in flushing out the toxins in the urine. Certain foodstuffs like cranberry juice, citrus fruits, they help in preventing the urinary infections. And whenever there are symptoms of urinary tract infection, immediately visit your urologist and take prompt treatment. Hello everyone, I am Dr. Suraj Muralidhar. Have you ever wondered that a kidney stone can cause urinary tract infection or vice versa, and a simple urinary tract infection can cause severe kidney infection or even sepsis? The short answer is yes. But let me quickly tell you by telling you a story of one of my patients who came with me with a simple symptom of low back pain with on and off fever and chills. Initially, I thought it must be a muscle strain. But however, on investigating, we came to know that it was a severe kidney infection, what we call as pyelonephritis, which was caused due to an untreated urinary tract infection from the past many days. And all this was caused due to a simple urinary stone, which was initially in the kidney and it later moved into the ureter, causing complete obstruction of the urine flow. So hence, understanding the link between these is very important, because recognizing this early and treating early helps in preventing certain complications. So basically, the urinary stones are nothing but deposits of the minerals which are dissolved in the urine, which actually form in the kidney. So these are actually the storehouse of bacteria, you can call them. So they can actually cause the urinary infection, and if at all it becomes severe, it can even spread into the bloodstream and sometimes cause sepsis. This urinary infection can sometimes be very mild and trivial. However, it can also ascend into the kidneys and cause very severe infection, which we know call it as pyelonephritis. And this can sometimes complicate in patients who are having other comorbidities like uncontrolled diabetes, hypertension, and other chronic disorders. So how long does it take for a simple urinary infection to actually cause a severe kidney infection? The duration, however, varies, but we can say sometimes it can take even within a week's time, and this can also further lead to complications like sepsis and sometimes even very severe complications causing death. So how do you diagnose this urinary infection? Patients come with simple symptoms like burning sensation while passing urine, sometimes even blood in the urine. They can also have pain on the side of the abdomen, which we call as flank pain. So all these symptoms classically point towards urinary infection. And the first thing to diagnose is we can do a urine culture and sensitivity. So there we get to know which antibiotics actually work against the bacterial infection which are present in the urine. So accordingly, a simple urinary infection can be treated by a course of antibiotics. However, when the infection is very severe, involving the kidneys, causing pyelonephritis, or in patients who are having uncontrolled diabetes, it can even cause a condition called as emphysematous pyelonephritis, and these conditions require admission, administration of certain higher antibiotics which are usually given through intravenous route, and sometimes even surgical interventions might be necessary like double J stenting. So what can you do to prevent this urinary infection? First and foremost, adequate hydration is important. For an average adult, consuming about 2.5 to 3 liters of water per day. So this helps in flushing out the toxins in the urine, and therefore the buildup of bacteria in the urine can be prevented, and hence the urinary infections can be avoided. Certain foodstuffs like cranberry juice, citrus fruits, they help in preventing the urinary infections. And whenever there are symptoms of urinary tract infection, immediately visit your urologist and take prompt treatment. Early diagnosis and early treatment will help in preventing complications. If you have got any questions, you can drop them in the comment section and I would be very happy to answer them. See you in the next video.